Hello, Patrick McKeown here. Thanks so much for supporting our Buteyko Clinic channel. Can I ask you a big favour? Would you mind subscribing? And with this, we can support the channel more, we can put out more videos, and it would really mean a lot. Buteyko, for me, has been life-changing and life-changing for the people that we're working with, and we would love to see it getting out there. So please subscribe. Thanks very much. Dr. Seb, you're very welcome. And I know our paths have crossed a number of times over the years. So just to give you a little bit of an intro, Dr. Seb, he runs a holistic dental practice. And in terms of looking at the whole connection of, I suppose, it's better off really for you to introduce yourself. And even when I come across the words like biochemical dentist, what does that mean? Biological dentist, what does that mean? So you obviously have an interest beyond dentistry, because a lot of people, I was only saying to you, if I go down to my local dentist in my Cullen, I know at most what's going to happen is he's going to fill a tooth, he's going to clean my teeth, he's going to do a couple of things, and that's it, and out the door. He's not going to say, "Oh, Patrick, you've got a high palate, or you've got scalloping in your tongue, or you might be at risk of obstructive sleep apnea." And you're clearly not that dentist. So who are you? Who is Dr. Seb?
Well, you're very modest in your own introduction, Patrick, because yes, our paths crossed, and you're one of the people that inspired me for this back in 2018, 19. I can't remember the year we were talking, weren't we, before? And just listening to you talk about the airway, the breathing from, it wasn't even so much the mouth then, was it? It was just about the mechanics of it and the function. And then I went on my own dive of really understanding how that is visualized as a dentist and did as much training as I could. But rewinding back, so biological dentistry, and I'm a bit more, I guess. If you think about what I've done, I went to biochemistry first, and that gave me a really good understanding of like how the body interacts on a Newtonian kind of like scale, right? The chemical interactions and the carbon dioxide exchange, the oxygen exchange, the lactic acid, all of the ATP production. That was kind of like my route into medicine and chemistry. And then I'll do this really quickly because I know most people probably already know this, but like I was really ill when I finished that degree, and I wasn't going into dentistry. I was going into work in a corporate in London, and that corporate company, I loved the pay, I loved the challenges of what I was learning, but I just it didn't feel me. It didn't feel me, and I wanted to be a dentist as a kid, which is strange. And I don't know why I wanted to be a dentist, but I didn't get the grades to go straight into it. So I thought, oh, maybe I didn't really want to be a dentist. Maybe it's about the money, right? And that's all it was. And I then actually went traveling before I went to this new graduate scheme, and I got really ill, ended up in intensive care in Bolivia. I had heart murmur, pulmonary edema, pneumonia, and my immune system was just shot after that, basically. And of course, being 21, you're like, ah, I'll bounce back. I've had my antibiotics. I've cleared everything out. But what I was finding is if I went and socialized and drank alcohol, my immune system, or I ate like shellfish or something, I'd get like all of these food poisoning. I'd get impetigo on my skin. It was just my body was not functioning. And I tried the medical route for a year, going to immunologists and people that were looking, like we were talking about the microbiome, the candida balances, and giving me like antibiotics, antifungals, antiparasitics, only the medical way of doing it, and pharmaceutical more importantly. And it just made me worse. I got worse and worse. And like towards the end of it, I was on these drugs, and all of the symptoms I was having weren't even going, but when I was taking them, there was just no support. So my then girlfriend, now wife, who I met on that graduate scheme, was very holistic, and she was all about calming the nervous system, doing yoga, looking at the microbiome of the gut, looking at the nutrition, cutting out sugar, cutting out alcohol. And I was like, oh no, it sounds like too much effort. I just want a pill to fix it, right? So anyway, a year probably of the pills and 9 courses of antibiotics, antifungals, antiparasitics, and nowhere better. I listened to her and went to immunologists that more thought about how she did it, and worked with homeopaths and gut microbiome testing. And it was a slow journey. It definitely was a slow journey, like getting back to my best. But by changing the food environment, the probiotics that I was taking, and I slowly got my new reference point of health and then went further than I'd ever experienced before, right? So during that process, I was speaking to these people, the immunologists, and they were asking me, like, what are you doing with your life? Like, are you happy? Do you want to do it? Which is so random, really, if you think about it, isn't it? And then they said, oh, I was like, yeah, I enjoy payday and, I get I'm happy with the challenge. And they said, what did you want to do? And I said, oh, I did want to be a dentist. And anyway, they put me in contact with King's College London, and that was the process again. So that's how I became a dentist. But then because I wanted to be a dentist, I thought, right, surely there has to be a dental sector that is like this health sector that got me better. And in parallel at that time, you're like this, Patrick, that my wife at that time, she was suffering with headaches, head, neck, shoulder pain, lower back pain, and she was changing all of her ergonomics on her keyboard and positions of her seating and having like these wheat patches on, lavender patches to try and cool her neck at the work. And we just thought it was her work. And then going to all of these ENTs and saying, what's going on here? Anyway, it turns out that we got to, and we went to some of the dentists then that were in this space. Like I think it was Patrick Grossman, Richard Dean, Alan Moffat, and John Roberts. And we were just seeing like what is actually happening. And we came to the conclusion that it's because she had had those 4 teeth out when she was younger. Her cage of her mouth was made smaller. Her tongue was set further back. She was clenching her teeth so much at nighttime. She wasn't getting a deep sleep, and her nervous system was dysregulated, right? And she was getting symptoms of TMD. And so her journey, in parallel with my journey, was opening up the spaces, relaxing her lower jaw. She found craniosacral therapy and osteopathy to really relax the muscles of the head and neck. And that got her out of the constant migraines and headaches and stuff. And yeah, so what's crazy is that at that time when I was studying, I was like, I have to shadow these dentists that do it because there's not many in the UK. Like you say, you go to your local dentist, they don't look at the airway, they don't look at the breathing, they certainly don't look at the microbiome, and they're not cautious about the materials they put in or how the mouth can affect the body's inflammatory systems. So I basically went into dentistry knowing that I needed to be this whatever holistic dentist term it was, and we've now tried to make it cooler with the biological dental tag, haven't we? But so yeah, that's a bit of a brief summary that we look at um, airway breathing, sleep disordered breathing screening, I guess, is the way of looking at it. Obviously, that then leads on to sleep apnea. I'm sure we're going to cover that, and that's starting from babies all the way to full-grown adults, and how we can intervene and stabilize and support them during that process, mechanically and functionally, which is obviously what you do as well. And then biocompatibility materials in the mouth, how the microbiome balance is if someone's got active disease and we can't get on top of it with the standard processes, through genetic testing, inflammatory testing, and then how surgeries and hidden infections in the jawbone can cause inflammation, right? So they're the kind of topics that we look at, and we work with functional doctors alongside us to trying to support our patients. So I hope that's a bit of a good enough intro for you.
I think it's amazing. I think it's really interesting. What I find even more interesting is that you're not the first dentist who has changed their route
Yeah,
based on their own personal experiences. And I think very often it's what drives us to change,
yes,
especially
absolutely.
when we go into something that would be considered not the norm or not the conventional route, that it's based on our own personal experiences. That yes, we recognize there was something wrong with us. We were going through the normal conventional route. It was helping, but it wasn't necessarily doing what we wanted it to do. And
Mhm.
we found a solution that worked alongside it, one that complemented the other. You point, there's so much in there. I don't know where to start, to be honest with you. But anyway, let's start off with sleep.
Yeah.
And because very often I feel that dentists are in an amazing position because they are looking into the mouth and they can see so many things that don't typically get spotted. And I'm going to talk about a middle-aged man or
Yes.
even a middle-aged woman, but of course it ranges right through to childhood. What are the typical kind of things that you will look at when a patient walks in your door that you may suspect that this person does need to have their sleep checked out?
So I guess the first bit is just chatting, really understanding what their sleep habits are like. How many times do they wake up at nighttime? How many times do they go to the toilet? Do they wake up with a dry mouth? Do they have to sip water through the night? Are they someone that typically gets headaches, head, neck, shoulder pain, migraines, lower back pain? Obviously, all these symptoms are multifactorial, right? But it helps us just understand what more we can associate with this. And as an adult, I there was this amazing book that really around the same time as meeting you, Felix Lau's book,
I
The
do.
Tiger
Yes.
in a 3 foot cage, right?
Yeah. Yeah.
So that image has always stayed with me, and I still use that to describe to my patients now.
Yeah. Can you explain a little bit? Because even when you talked about your wife's tooth extraction, maybe some
Yes.
of our listeners may not understand what was the implications there. So
Absolutely. So our ancestors had 32 teeth in their mouth with a nice wide dental arch. We call that the cage in Felix's book. That's the cage of the mouth. And then the tongue, or is the tiger, what lives inside that cage. If you stick your tongue out and you look at it, it looks round, right? It looks, U-shaped. So that theory and the myofunctional theory and all of the breathing practices when the tongue's in the roof of the mouth, of course, for optimal nasal breathing, we have that shape of the tongue around the teeth. And it's more notable when we're younger because we're growing, we're developing, we can see the changes quickly when we start to change those practices. But as an adult, your cage of the mouth dictates where your tongue position is. So let's say this is the spine, this is the tongue. Like we want our tongue to be up here. So when you're sleeping, the soft palate is almost supporting it and it's lightly suctioned to the roof of the mouth. But what I have noticed is that if the cage of the mouth is smaller, so the shape of the teeth, the lack of teeth, when someone's lost a lot of teeth, the smaller that cage gets, the more posterior that tongue gets, the more it bulges back into the airway, and the less likely it is to be able to fit in the roof of the mouth and be suctioned there gently. So that means at nighttime that tongue is constantly falling back, so that patient is thrusting their tongue, like you said earlier. Tongue scalloping is one of the signs that we look for. Because if someone's totally pushing their tongue out of their airway and their teeth are in the way, they get the imprints of the teeth onto the tongue. We look at bite lines on the sides of the tongue or sides of the cheek. They just look like little white lines because when I close my eyes and I envisage sleep disordered breathing or upper airway resistance, how we look at the syndrome before sleep apnea, I think there's nasal breathing, which is optimum, with the tongue positioned in the roof of the mouth. There's then tongue thrusting, which is my kind of next, like in terms of severity, that's how I go to tongue thrusting with the scalloping. There is then the clenching, and that's where teeth start to chip and break. So we see a history of breakages, lots of fillings. Teeth interdigitate like this, like in between each other. So they lock in, the cusps lock into the fissures. So if someone's clenching, they have tiny micro cracks, lots of staining in their teeth. So the food gets in, the staining happens, decay happens, and then the body arrests it, remineralizes it so it goes black. So then you see the staining. That's a whole nother thing. Grinding is the next phase. The grinding to me is where someone's teeth, when they can't tongue thrust to open the airway, and when they can't clench to tone the musculature of the airway to open it, they grind. So when you grind your jaw forward, it gives you that airway space, a bit like the recovery position, right? So when you grind, you get very, very flat teeth. I often see this as more of a man trait than a female trait. Most men grind their teeth, most women clench their teeth. It's just something I've noticed in my clinical practice. And then what we do is obviously we look at if there's loads of history of root canals, extractions, lots of filling, we then and they've got all of those signs that we just talked about, the tongue scalloping, the biting of the cheeks, the poor sleep history, the not waking up so much. We often say you probably need to go and get a sleep test because it's quite likely that you have a sleep disordered breathing, if not sleep apnea syndrome here, mild to moderate, or if not severe, which is a medical diagnosis, right? And that is linked to cardiovascular problems, which you just do not want.
Oh, totally. And even, it's quite different as well, female to male, in terms
Yeah.
of, you mentioned about upper airway resistance syndrome. So just for context, what Dr. Seb is talking about, he's talking about the airways. So we're talking about the space at the back of the nose where it meets the throat, and also at the back of the mouth where it meets the throat, and then the throat itself. And
Yeah.
that's a collapsible tube. And a good airway, there's not a whole lot of room for error. Like a good airway is about the size of a garden hose pipe or the size of your thumb.
Yes.
And you described as well, if children are having their mouth open, they can't have their tongue resting in the roof of the mouth. And as a
Yes.
result, then the pressures of the lips and the cheeks are almost pushing the jaws inwards, or it contributes to a V-shaped top jaw in
Yes.
comparison to the U-shaped top jaw that you talked about. And then that child is going to have overcrowding of teeth, and overcrowding of teeth could point at the problem is not necessarily that the teeth are too big, but the problem is that the jaw is too small to house those teeth. And then you said that when the mouth is too small, the tongue is not able to rest in the roof of the mouth. And as a result, you're going to have a low resting posture. And that
Yeah.
tongue then is going to be encroaching, going back into the airway. It's amazing how many people are affected by this. You know, the stats are 936 million people are estimated to have sleep apnea on the planet.
Wow.
936 million. Upper airway resistance syndrome. Let's just talk a little bit about that. Um, it's a tricky one.
It's a grey area, isn't it?
Mm,
It's I look I how I describe it is it's a sliding scale. This being sleep apnea, and then this grey area here is all of the
yes.
upper airway resistance, sleep disordered breathing, syndrome, whatever we want to call it. And that is a combination. Some people can be clenching their teeth at night time. And we talked about this as well, because there's a whole other aspect to sleep disordered breathing, upper airway resistance, which is the autonomic nervous system part of it. Because when your airway collapses at nighttime, your body says, well, I'm not getting enough oxygen here, so I need fight or flight response to wake myself up, push my jaw forward, roll over and breathe a bit better. And that puts your body into panic, right? So when you have those arousals, those episodes at nighttime, you're um, it's not like what's the word? You're strengthening that autonomic nervous system response. So it means you're going to be more prone to being more anxious during the day, more fight or flight during the day. That's how I see it all the time. And when we manage to stabilize things through adults, through children, you notice. I mean, in kids, and you know this, the concentration, the focus, the ability to remember more of the information from the day before all improves. Patients report that for their children all the time, just through proper breathing, tongue position practices. So it just shows you how much of a nervous system effect it actually has on the body. And the other thing that I was going to touch on earlier is, when you said the V-shaped mouth and the lower jaw being open, is that the I don't know why this effect happens, but it's something the body does. The more that there's no contact between teeth and there's more of an open mouth posture, the more the top jaw comes downwards. They get more gummy smiles. The lower jaw is then, when they're biting, is more retruded. So it's this massive vicious cycle that we have to try and break. And it's so much easier to do as a child than an adult, because the bone is much softer, more pliable. They're still growing. So we've got room to change and mold and improve it. I mean, the other massive topic about this is about tongue ties, right? And how that can affect the position of the tongue in the mouth, how it affects whether the tongue can hold itself in the roof of the mouth and say suction there. Or does that deep line fascia that connects through the body, that heavy into the diaphragm when they're diaphragmatically breathing in deep sleep, does it pull that tongue down? Does it block their airway from just a completely left field? I only learned about this probably 2 years ago now, and it's kind of revolutionized how I think about the whole stabilization of the airway. Because I had these patients that we were trying the splint therapy, we were doing the nasal breathing practices, we were doing the tongue strengthening practices, but they were still grinding, clenching like mad. Why? Because they had this, I call it the adult tongue tie, which I technical is the posterior tongue tie, but the adult tongue tie I call it because it's not spotted as a baby, right? Because the babies can feed. It's just the tongue compensates by pulling on the floor of the mouth muscles to help it move. But you can't do that at night time when you're asleep and the only thing moving is the diaphragm.
So in that instance, then, I probably have a tongue tie, but I'm scared of my life to go to anybody to have it. I just have one of these things about somebody going near my tongue. So we won't even go there. And I'm sure there's plenty of people listening to it here. Resistance is a word that we often talk about, but we don't really explain it. Can you kind of explain that in a more simple way in terms of, say, the pipe of the airway?
Yeah. Well,
And
you
if
you
some,
taught me this. Basically, that pipe of the airway is a muscular tube, right? And that muscular tube is collapsible depending on the tone of it. So the tighter the muscle, the less collapsible it is, because when you're breathing in from the diaphragm, the deep, if you think about the air pressure that pulls down, you in fact taught me this saying as well that I use over and over again, that if you have like this really thick smoothie and you put a straw in it and you try and suction it, the straw collapses. So if you have resistance in your airway and your deep breathing practices, you're more likely for it to close at nighttime when none of the muscles are turned on apart from the diaphragm. And that obviously we have snoring, which is one of the signs of resisting of the airway, normally at the soft palate area. People that wake up with sore throats, hoarse voices in the morning, you know that that air's been drying out all night. The airway's been collapsing because the tongue's fallen into the wrong place. So for me, it's a harder one to diagnose. But in the mouth, we look at, are the teeth worn flat? Are there multiple fillings? Is there wear on the front teeth, chips everywhere? Does someone have a history of lots of dental issues, chips, breaks, extractions, root canals? And all the history around their sleep and how much energy they have, right? They're kind of the
Mm.
signs that we look at. But what's strange is that when patients come to see me in the initial consultation, or anyone in our team nowadays, and they go through all the thing, oh no, I don't clench, no, I don't have any airway resistance. And then when they come back after we've made them aware of what could potentially be doing, they're like, oh, I did wake up with a tight jaw that morning and I could feel my muscle. Oh, I did notice this headache. So it's amazing how unaware we are in life sometimes until someone points something out, right?
Totally. And even waking up with a dry mouth in the morning, like it was always a question that we've asked people, and some people are kind of aware of it, but
Yeah.
many people aren't. And it's a huge telltale sign. If you wake up with a dry mouth in the morning, it's likely that you have been mouth breathing during sleep. And it comes back to what we talked about earlier on: low tongue resting posture, the lower jaw is falling back into the airway. So the airway is narrower. So this pipe, the throat, we'll just keep it simple, is becoming narrow. And as a
Yeah.
result, then air is not able to flow so freely from the nose to the lungs and back out again. And because the air isn't able to flow so freely, that there's an increased resistance.
Yes.
And you spoke then about, in terms of upper airway resistance syndrome, which affects more women than men.
Mm,
And this is the gray area, because that increased resistance, it doesn't manifest as snoring. It doesn't manifest as a drop in blood oxygen saturation or reduction in the volume of
yeah.
breathing, but it's the increased resistance, in other words, the increased effort that has been brought about for the female more so than the man, because she's trying to get the air into her lungs, because the airway is that little bit narrower. There's an increased effort in breathing, and it's the increased effort in breathing that takes her out of the deeper sleep. So now she's spending more time in light sleep and less time in deep sleep.
Yeah.
And then she has symptoms such as increased panic disorder, anxiety, fibromyalgia, chronic fatigue syndrome, depression, and even an increased risk of dementia.
Yeah.
And this condition was only identified in 1993. But if she does a sleep study, she may come back with her AHI is less than 5 events per hour. In other
Yeah.
words, she doesn't have sleep apnea. Her blood oxygen saturation isn't going below 92%. So she's not going hypoxic. She's not having hypopneas. So, in other words, that she doesn't have a sleep issue, but she has symptoms associated with this. Is the subtlety, isn't it? Um,
Yes.
in terms of even the female breathing, or female sleep different to male sleep. So again, yeah, it's one of those things. Um, let's talk about mouth breathing from a dentist point of view.
Yeah.
So we'll just think about this as a child going into a dental practice, and a child who is persistently mouth breathing versus nasal breathing. In terms of dental health, the only thing that I seem to hear is get your toothbrush and plenty of toothpaste and off you go, and don't be eating sweets. But it goes beyond that.
And so much further. I think one of my most viral videos on Instagram was that I believe mouth breathing is just as important as nasal breathing is just as important as brushing your teeth, right, at nighttime. And the main reason for that is because let's just think about the oral cavity. We have teeth that are crystals, and they require calcium and phosphate to stay crystalline and stay strong. You have the bugs that live in the mouth that break down acids, break down food and cause acids which demineralize the teeth. But you also have the bad bugs that are looking for the glucose in the gums and trying to feed on the glucose. So you need to keep them at bay. Now, what does saliva do? Saliva is this master washer into the stomach to regulate the microbiome and destroy the bad bugs. But it's also got your own immune cells in there that try and balance the bad and good bug balance. So, if you're mouth breathing, what are you doing? You're drying out the oral cavity. The saliva also releases minerals from your food that you've digested to remineralize the teeth. So, you're doing a number of things. One, you are drying out the oral cavity, which is stopping the saliva from remineralizing the teeth from the minerals that are in it. Two, it's not got the immune function because it's not going into all the places where the food may be, where the bugs, the plaques may be, the anaerobic bugs may be, to try and balance those. And also, if your tongue is low and your mouth breathing, you're prone to clenching, grinding, breaking your teeth, which means you're going to be more prone to decay and gum disease. If your teeth don't load in a way that's balanced in terms of the bite and you're clenching your teeth, you're going to be pushing, chipping, breaking things or causing inflammation in the gums too. So it's like this. We've moved so far away from it in the medical world, haven't we, in dental schools? But actually, if you breathe better, your oral health is better, the less dental intervention you'll need.
But it's amazing, and I'm delighted that that post that you put out there that nasal breathing is just as important as washing as brushing your teeth, because very often it's not taken into consideration. So basically, saliva is playing the role of helping to minimize the bad bacteria, and also it plays a role in the remineralization of teeth. We
Yeah.
talked about when the mouth goes dry, because if you're mouth breathing, you're losing a lot of moisture, you become more dehydrated, but also the mouth itself goes dry, and then the bad bacteria can literally play havoc.
Yes.
Um, so good bacteria, bad bacteria. How might somebody know if they have bad bacteria? And what can they do aside from, and is there another impact there as well? So that's changing the microbiome in the mouth. But every time that you swallow, so if you have a dry mouth, you're still having to swallow. Are you now carrying more of that bad bacteria into your gut? Is this
Yeah.
then impacting the gut microbiome? Or
And of course, the mouth comes before the gut. So the mouth wins. That's what causes all the problems in the gut. That's what I always joke about with the doctors. That ultimately, yes, you're right, because you have more anaerobic bacteria that forms the biofilms in area where the saliva and the air can't get to, and they're the ones. If you look at, so yes, good bacteria, their function, or commensal bacteria is what we call it. Their function is to help remineralization of the teeth, break down food particles for themselves, but it also helps us, and it's not as an acidic way, and it helps us digest our food. Whereas the bad bugs, the spirochetes, the Porphyromonas gingivalis, the ones that cause gum disease, and Streptococcus mutans, which are the ones that are more associated with the decay in the mouth, they are shown in much higher concentrations when you have those diseases there. And what I love to see is that yes, you can test it. So when you look at the mouth and the layout of the land, you look at how many of each of the ones are in there. Because of course there could be some bad bugs living in there, but as long as they're on the smaller scale, you know that they're not going to be thriving in that. So how we kind of do it at our clinic, I guess if I really think about it, is anyone that comes into our world, we say, right, this is how you brush and clean your teeth. This is the adjuncts you use to help remineralize, keep the gums healthy. These are the foods to look out for to help your body support your immune system in that aspect. We go away, we come back and we do an inflammatory check, right? And we say, is the inflammation levels looking better? Is there less plaque in the mouth? Is there less bleeding? Are we happy with the result? If we're not happy with the result, then we can do some testing of the bugs. And this is the interesting thing, that I have to close my eyes to get into the zone here. So, like, what I do is that you've got this war going on in the mouth between the good and the bad, and they are always constantly fighting for survival of all the food and stuff that goes in there and the practices that you use. And what you have is you've got that war between the bugs, but then you've got your body's response to that war between the bugs. So someone's inflammation status, and some people are more inflammatory than others in terms of like how their body attacks things or responds to things, means that they're more likely to have gum disease if they are highly reactive, if they're like, right, um, there's that bug there that I know is bad and it's living in the gum, so I'm going to go at it and I'm going to cause inflammation. But in that, um, it's like a self-destruct method that the bone is like um, the victim in the fight because then you have pockets that are formed from all that inflammation and more bugs come in and your body's trying to fight it off. So it's like we look at not just the bugs in the mouth and the war that's going on, but how your body responds to inflammation through genetic testing. And then once we know, because these are only the people that we can't, or the patients that we can't get to the bottom of something, right? And we've done everything we normally do. We've used our lasers and ozone and all our cool things that we try to support the microbiome with and the health of the body. But sometimes we need to know why is that person so reactive? And if they are, we say, right, you need to supplement with anti-inflammatories, curcumins, natural things, polyphenols, get your body more relaxed and help with the breathing, because if you're, like we said, at nighttime, if someone's in fight or flight, guess what? Their body's going to be more inflamed, right? They're going to be fighting things off more than someone that is totally in their nervous system of rest and digest. So, it's a great analogy, isn't it?
Oh, I think it's amazing, like the autonomic nervous system. So, for our listeners, Seb is really referring to the automatic functioning of the body that's
Yeah.
happening outside of your own volitional your control. And normally we want it to be in balance, but a lot of us chronic stresses and also poor sleep quality, mouth breathing, dysfunctional breathing patterns. So many things can tip us into this increased stress response. And it was interesting what you said about poor sleep. So yeah, if your airway collapses, and I think people might be able to identify this. Is it that, say, for example, whenever the airway is collapsing during sleep, and the brain then senses this drop in oxygen, and of course, the brain needs a lot of oxygen. 20% of the oxygen that we take into the body is going to the brain. So the
Hmm.
brain is very heavily dependent on oxygen. And if we stop breathing because the airway is collapsed, the throat is collapsed, and oxygen can't get into the body, oxygen is going to lower in the blood. The brain's going to pick up on this, and the brain's going to do whatever it can do to restore breathing.
Yeah.
But then the person may wake up and their heart rate is just bump, 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 bump. So that's kind of an indication that that individual has gone into that increased sympathetic drive.
Yeah, and I wonder, this is just us surmising here though, but when people wake up and they're in a night terror or they're in
Mm,
like that fear, that's probably just that they were in a lovely sleep and then all of a sudden what's going
yeah,
on? And
yeah,
the body's just trying to wake you up. There's no
yeah.
science behind that, is there? But it makes sense.
And it's then not isolated. So that increased sympathetic drive is going to carry into throughout the day. So
Yes.
that person, and I was wondering, because sometimes it's confusing when we talk about sympathetic.
Yes.
Oftentimes we feel that sympathetic is this is relaxation, this is support. But the word sympathetic, when it comes to the fight or flight or the autonomic nervous system, it means that you're going into this fight or flight
Yeah.
response. And then I was wondering, well, what does the word sympathetic in this context mean? And it comes from Latin, and it basically means that the body is mobilizing all resources.
Mm.
So this kind of puts it in context. So now you have this individual who's chronic mouth breathing, who's clenching, who's biting, who's doing all the things that you spoke about. They're going into this increased stress response. The body is mobilizing all resources now to try and protect this person, meaning that there's a lot of energy being expended,
Yeah. Yeah.
and there's energy being expended here that's not necessarily available over here.
Yes,
And
exactly.
we can't, we can't stay in this state indefinitely. This autonomic nervous system. Do people function well? Your patients who are coming in with sleep, and in a very practical, so say for example, and a very practical, what do you notice about the people you pick up in things? You refer them to a sleep study. What do you notice about them?
Great question. Everyone presents totally differently, but if I think about the two groups that I see the most, it's either someone that is overstimulated, hyperaware, super anxious, and actually that's normally the women, if I think about it. And men typically are really lethargic, no energy, no drive, can't wake up in the mornings, falling asleep quite a lot. And I think that just depends on which nervous system the body shifts into because of the lack of energy, lack of like a rebuilding of at nighttime, because you might know a bit about this as well, but you know, the glymphatic system at nighttime, when you go into deep sleep and you stay in it long enough, your brain shrinks, it pushes out all the toxins, and your body detoxes essentially. But if you're not in deep sleep, you're not doing that. And if you're not doing that for X amount of months, years, however long, your body, how can it function, right? So then I'm a total believer that so that's what I see, that when they're in that state and they've been in that state for a long time, they're in that low grade chronic inflammatory state. When we get them breathe, and it's not an easy thing all the time to get someone breathing properly at nighttime, and it depends on how severe it is. If we need the mechanical support, if we need just the myofunctional therapy and the breathing practices, or we actually have to do you know, in some cases surgery or CPAP for someone to help them breathe, at least in the meantime, until we get to the bottom of it. But as soon as they've done whatever things that we do to stabilize their airway at nighttime, what do they get? They get a deeper sleep, waking up less, more focus, more concentration, more energy, less aches, shoulder pain from all the tension that they're carrying at nighttime. And their body's not expending all of that energy to help them breathe at nighttime, right? So they're just in general, they look more vital, they look more healthy.
It's very interesting you spoke there. Dr. Christian Guilleminault, you'll be aware of his work, and he said he's passed on, unfortunately, in 2019, but he said that females were the forgotten gender when it came to sleep.
Mm,
And earlier on, we talked about that they can have quite subtle changes in their breathing, which takes them out of deep sleep. But you there talked about with your patients,
yes,
it's more that the females who are having dysregulation or dysregulation with their sleep, they're more prone to mental health issues such as panic disorder,
yes,
anxiety,
definitely.
um,
I notice it
whereas
so much
men are
more.
more likely to be tired. But the whole sleep industry is kind of being tailored towards men and less tailored towards women. So there's
Absolutely.
probably quite a few females listening and wondering, well, do I have symptoms? Are my symptoms just genetic, or do I have an underlying sleep disorder? I like the point as well that you made. The ultimate goal is really to improve sleep, and using more. You've got quite a few tools,
Yeah,
which is very helpful, because I know with CPAP it's the gold standard of treatment. The issue is that the compliance rates can be difficult enough.
yes.
It works, but 50% of people, well, 40% of people are the only ones. Okay, let's look at this in terms of the stats in sleep apnea. Say, for example, there's 100 people with sleep apnea in a village. Only 15 of them will get diagnosed.
Hmm.
85% will have sleep apnea and they don't even know they have it. There's a role for the dentist,
Absolutely.
because
Absolutely.
they straight away they will see all of those red flags, and to be able to advise their client to get this checked out. So out of the 15 people that get diagnosed, only 40% of them take up treatment. So now you're down from 15 to about 6 people. And of that 6 people, 50% will abandon treatment in 3 to 6 months. And they're the stats. So now
Yeah.
you're left with 100 people in the village with sleep apnea, 3 people are on CPAP. Now we can even break this further. The people then who are on CPAP with their mouth open, they reduce compliance. And the reason being is because they have to wear a full face mask.
Yeah.
They're wearing that. And of course, the CPAP is splinting air to help open up the airways. But because their mouth is open, the things that you talked about earlier on, their tongue is in the low resting posture, the mandible is falling back. So anatomically, their mouth breathing is narrowing the airway.
Hmm.
So now the CPAP is designed to be able to splint open the airway at a pressure that's sufficient to open up that airway. But the CPAP, the mouth breathing is fighting the CPAP. So in
Yeah.
order then to splint open the airway, you have to raise the pressure of the CPAP. So now there's the air coming in at a higher pressure. The person is wearing a full face mask. It increases the risk of leak. They have to wear it tight, and the compliance levels are dropping. And
Hmm.
again, nose breathing has been forgotten about while wearing a CPAP.
Yes.
So where do where do we go with this? Uh, so just in terms of, do you see a change in? I know you're in this circle, and you'll be talking with other dentists and the conversations that you're having. To see the role as of a dentist as going beyond just teeth, because
Yeah.
you're able to see the connectedness between the mouth and how it's impacting other aspects of the body. Um, what's your take on that?
We need a referral system, a pathway, in the UK that actually allows for it because there's just no one to refer to. There's only maybe two. I think you're in those groups with me as well, aren't you? The everyone from every professional that's interested in the airway, and out of the ENT surgeons, there's maybe only two in the whole group, I think, that actually support patients with breathing practices, opening up the septums and nasal passageways. But I honestly think that the dentist, obviously, any dentist can screen for this stuff as long as they know it, right? And that's going to cause a problem to start with because we don't have the support routes. Because there's so many things to think about, isn't there? Because first of all, you've got to be able to breathe through the nose, number one. So you've got to check the septum, we've got to check the sinuses, we've got to check the ostia are open, we've got to check the inflammation in the levels in the body are low enough so the turbinates aren't too wide, so they can't breathe properly through the nose. We've then got the dentist to be able to check they've got enough space in their mouth for the tongue to live there, that they have a good skeletal posture, and if not, then we have to do mechanical support and appliances to get things bigger. And then we've got the practitioners that you train to actually just support breathing mechanics, right? And actually the right way to do things once we are able to do it. So that's kind of like the group of people that need to be available. And then, of course, even before that, we talked about the tongue ties, didn't we? Someone to be able to offer that surgery for people to support their tongue position, which we've talked about is for optimal breathing. So I spoke to a dentist last night actually, and she has been working in the NHS for the last 3 years. And since, this information is available to us now, isn't it, online? And as a healthcare provider that we're trained to try and support our patients, she feels trapped in the current role because she can just see sleep disordered breathing all over her patient care, but she can't do anything. In the NHS, you can only prescribe a soft splint, which doesn't open up the air without them paying, of course, which doesn't open up the airway, and it causes them to bite more, clench more. She's referred hundreds of kids for tongue tie releases because they're babies as well. When the mums bring them in, no one's doing any of it. And yeah, it's a super sad place at the moment, but we have to be aware of the problem first before we fix it, don't we? So
Oh,
now,
absolutely. And even, if there's a dentist able to spot possible risk factors,
exactly.
and just even to say to the patient, listen, I think there's something here. Can you get this checked out?
Yes.
It's not causing any harm. It's making the person more aware of it. And, they're not going to make any changes without knowing about it in the first place. So I think it's really huge, even though I know there's limits and I know there's obstacles and nothing is perfect. But at the
No.
same time, it's seeming going in the right direction. I'll put it
Um,
this way, Seb, there's a greater awareness of breathing now than there was 20 years ago.
yeah, you've
And
lived it.
and even like in dentistry as well, it's happening in the last 5 years too. So things are changing, and I think it's going to be driven by grassroots.
Yes.
Um, so in terms of your practice, how can people, if they're looking for more information to find out about you, are you on social media?
Yeah, I my social media is so it's biological underscore dentist, and our practice is Wonder of Wellness, all one word, and our website is wonderofwellness.co.uk. And I currently have 4 surgeries with nearly 4 clinicians in every single day, which we've built up to over the last 2 years. Because, like you say, the awareness is growing so much, and people are so keen to support themselves. And even if someone can't afford the route yet, just becoming aware and doing breathing
Absolutely.
practices, tongue strengthening, posturing, yeah, I've still seen it change lives, which is amazing.
Mm,
And that has got to be the mission in the UK. And my actual mission in the UK is to make dental schools aware of this and to try and influence the teaching patterns for that. I think America, right, last year released that, it's almost going to become malpractice if dentists are not telling their patients about this now because it's so obvious to us when there's a lot of tooth wear in the mouth that they must be having an airway issue.
yeah. Oh, it's a no-brainer. I wrote about it in the breathing cure. I
Yes.
wrote about it in the sleep. like I, as a middle-aged man, I hardly go to a doctor. That's been honest with you. I went to the doctor first time about 2 years ago in 10 years. And I would be this individual who is at a high risk of sleep apnea.
Yes.
And if I'm not going to medical doctors, how many middle-aged men are going to medical doctors? I don't say that as a sexist thing, but I think women are more likely to go to a medical doctor. But the man is more likely to go to his dentist. And
Yes.
he's at least going to see his dentist once yearly and possibly every 6 months.
Yes.
And there is an ideal situation. And I remember Dr. Christian Guimaraud, he talked about individuals coming into him because he was one of these pioneers in sleep medicine. Individuals coming into him at 40 years of age. And he said these individuals had sleep apnea and they were first identified at 40 years of age. And he said we could have identified this so much sooner. And the
Mm.
reason being was because they had tootogenesis. They were
Yeah.
missing teeth, either due to extraction or due to genetics. And again, it points to these are the telltale signs that can be picked up. And there has to be a conversation about that. You know, I was lucky. I came across nose breathing in 1998. It absolutely changed my life. And yet 30 to 60% of children are out there persistently mouth breathing. We
Yes.
have hardly any stats for adults because there's only been two studies that I'm aware of, and it shows 17%. But how did they gauge, like, what's the definition of mouth breathing? You know,
Mm.
we know with sleep it's about 50%, but again, it's very, very understudied. So, yeah, in the UK, whereabouts are you based?
Good question. We are in between Leeds and Manchester, just off the M62. It's probably the easiest way to describe it. Closest town is Huddersfield.
Oh, we've all heard of Huddersfield. Um, in terms of, well, something is happening. You've got four surgeries, so
Uh,
the people are voting by attending your clinics.
yeah.
So you're
Amazing.
definitely on the right path, and I'd say kudos to you. That's brilliant. Well done.
Yeah, thank you. And thank you for all you share and do and pioneer, my friend. And it's been a pleasure speaking to you.
Likewise. Thanks very much, Seb.